we are being respectful of everybody's time, we're going to go ahead and get started. Thank you so much for everybody for being here for today's technical assistance training by EndHIV901. And without further ado, I am going to introduce our consultant. So today we have Jasmine Tasaki joining us as our technical assistance trainer for our training on trans humility cultural sensitivity training. So a little bit about Jasmine before I turn the mic over to her. So Jasmine is a staunch advocate and community organizer for trans women and issues affecting trans rights, health, and housing. So she has a very deep passion for intersectionality. And she comes to us with experience from work as a PrEP navigator, an HIV counselor, a sexual health educator, and cultural competency facilitator for the Memphis Police Department. She's also known as the first leader of trans experience in the National Urban League of Young Professionals Health Literacy and Advocacy Chairperson, Memphis chapter, and an ambassador for the Black AIDS Institute. And also, she is the founder and CEO of WeCareTN. So without further ado, I'm going to go ahead and turn it over to Jasmine. But real quick inserting, if you to reduce the bandwidth, we're going to turn off our cameras in the room, so giving Jasmine the full capacity she needs. And then of course enjoy the training. I'm excited. Thank you, Jasmine.
I'm sorry. I was still on mute. Okay, give me a thumbs up, Zach, if you can hear me. I can still see your camera. Okay, perfect. Okay. Hi, everybody. I'm Jasmine Tasaki. I would love for today to be an engaging conversation. I'm going to be giving lots of information. I'm going to give us a little time at the end for questions as well, but please feel free to chime in, or I may ask, are there any questions, but I kind of tend to just be on robot mode. So if anyone has any questions, please let me know. So today's training will be a trans humility and cultural training. I'm sorry, I don't know how I'm going to work my slides. Okay. So yes, as I said, I'm Jasmine Tasaki. I'm the founder and executive director. Here's my staff. I have a wonderful, amazing team of people who make sure that our events go off without a hitch. Our programs are implemented in a way that is equitable and that people really feel that presence that WeCare has always tried to embody since our inception. So this team really makes my work grow and grow and grow and grow. So it's not just about the work that I do, but it's about the work that we do. So WeCareTN, our organization vision is to empower the lives of TGLBQLBIA people in the Mid-South with self-care and development tools that will build sustainable self-advocacy for their personal and professional goals. Our values are inclusion, accessibility, and integrity. Our mission is to support trans women of color through, support trans women of color through empowerment with the goal that they have the quality of life as envisioned. Today, we're going to have a couple of community agreements. Please feel free to come off. These are just some suggested agreements. Be present both physically and mentally, right? Actively participate, ask questions, reflect on your own experience, be respectful of each other's experiences, seek to maintain a growth mindset, and be rooted in respect. All right, so we're going to talk about social determinants of health first. And when it comes to, well, social determinants of health and the literacy levels within that, right? So we're talking about economic stability. That's your socioeconomic conditions, such as your income level, job opportunities, food insecurities, and housing instability, right? Then we're talking about education or your access to education. Um, what were your early childhood experiences and your development? How did you show up in school? How did you adhere to those procedures? How did you adhere to those services that were provided to you as a child? Then you have social and community context. So, what were the social norms and attitudes within your community? Right? Was there discrimination? Was there incarceration? And then we talk about health and healthcare, access to healthcare services, your health literacy levels, right? Or even your understanding of how healthcare works. It's something that's not on here, but it's really big in communities of color. Then we think about neighborhood and built environment, your living conditions, your access to clean water and healthy foods, exposure to violence, and your access to public transportation or your use of public transportation. All these things play into your social determinants of health, right? And when we're thinking about not only our participants, because I like to call them participants instead of clients, when we're thinking about our participants' social determinants of health, we also should think about our own social determinants of health because it actually helps us to raise the bar and set the bar of how we provide services. So organizations that center socioeconomic factors recognize that the realities of various social inequalities affect both people's vulnerability to and capacity for effectively dealing with potential harm, right? So not only dealing with potential harm, but these people are navigating life from these social inequalities. So oftentimes when we're providing services and people come into our organizations or our CBOs or our hospitals and or clinics, they are there for services that do not need to further traumatize them or trigger them. And we have to honor that these socioeconomic factors play a part in how they navigate the services that we provide. So we need to censor the services that we provide in these social determinants of health, in these socioeconomic factors. And how do pronouns and autonomy play a part of this? And how do they complement and play and go hand in hand with each other? Well, I'll tell you, when you ask someone their pronouns, when you honor someone's pronouns, you are validating their experience to be centered around them. I'm sorry. And also you are honoring that they have autonomy, right? To make the decisions that they come to make, but also oftentimes people who are transgender have an experience of not being able to exercise their autonomy. So this use of pronouns can actually affirm them in that space and give them that nudge to exercise that autonomy that they may not be exercising often because of those socioeconomic factors or because of trauma or abuse, mental health issues. There could be many reasons that trans people do not often exercise their autonomy, and just using their pronouns affirms them and encourages them to use that autonomy, right? And we touched on mental health, but mental health plays a big part in how our participants show up and how they navigate spaces, right? Not only when they come into our organizations for services, but also how they navigate their everyday lives. And having that relationship with them where you can check in and center their mental health allows them to process some things with you and also allows them to move forward through some of the things that they may be going through or maybe looking at in life. So we want to make sure that not only are we centering the socioeconomic factors, but we're also using the proper required pronouns. We're asking about pronouns. If we're not sure, we're asking what are the pronouns. We're modeling the behavior of giving our pronouns. So everyone feels comfortable and it becomes normalized. But then we also have to take into consideration people's mental health. So all these things help us to provide cultural competence services. And then let's talk about bias. So there are two types of biases. You have your explicit bias and your implicit bias. So what makes them different, right? So what is a bias? A bias is an attitude or stereotype in favor of, right? What makes it explicit is it's deliberately acted upon. It's physical, it's verbal, it's an act of exclusion. Implicit bias, right? This is a bias that is unconscious, that unconsciously alters our perceptions of our understanding of our experiences, therefore affecting the behavior and our interactions and decision making, right? So oftentimes we see implicit bias happen when people may not be aware. And even if they are aware of the bias, they may not understand how their behavior changes because of the bias or how they may interact with people because of the bias. And ultimately, having an implicit bias allows your decision making to be different than someone who is aware and cognizant of the bias that they hold. So I often make the joke that I have a bias in favor of soul food. I travel all the time, but everywhere I go, I got to have some soul food. So I tend to turn down restaurants that don't serve soul food when I travel. I also have a bias to steakhouses, but I have an explicit bias where I exclude myself because I don't want to go to the restaurant, or I say, ew, I don't want to go there. I like soul food, right? That's explicit. And then there's a such thing as implicit. And for me, I think my implicit bias, I don't have one that I'm aware of now, but I have been um, more favorable to the South and people from the South and like cultures and traditions in the South. So I've always made decisions or planned things right according to how we do things in the South. And I view those things as the right way when now I know them to be traditions, which can still be celebrated, but I don't weigh them as, the right way, or I don't look at it as a better way. It's just a different way, and it may be the way that I'm familiar with, right? But I no longer allow those biases to come into play when I go places and things aren't done the way that I would do them. Um, I have learned to honor that everyone has space to make their own decisions. So that's a little bit of my bias and my experience. I would ask if someone can come off mute and tell me about a bias that you have, or a bias that you are aware of, or about a time that someone made you aware of a bias that they saw within you and you were like, where you may have had an aha moment. Do I have anybody that can talk to us a little bit about bias? Just a little bit.
I don't mind.
Thank you.
So one of my biases that I acknowledge, and I feel like it kind of walks the line of explicit and implicit, in the sense that I believe that some of it is like due to trauma or, let me get to it because maybe that'll explain better. So I pause or have reservations sometimes when I'm going to a because it has to be, I guess it's like more of a black owned business or like something like that. Sometimes it can make me uneasy or question whether or not I want to patron that place just because of like past experiences and people kind of being not nice. So sometimes when I hear like, oh, we'll go here, if I look at the IG or whatever it is and I feel like it's a little black centered, sometimes it can make me, you know what I'm saying, not want to go. Um, and once I kind of realized that I would do that, I've been working on like giving people a chance and an opportunity. because I know things are changing, but just someone who has kind of like walked in this lifestyle for as long as I have. And I do feel like it is getting better. Um, my presence and arrival can be jarring to some Black people, and so it will cause them to act out or make, you know what I'm saying, a scene or whatever it is. And it's happened to me so many times that now I think I've sometimes internalized that reaction, and in order to avoid it, I will avoid those settings. But like I said, now that I kind of see that I do that, um, I challenge myself to go into those spaces because um, I do believe that even if you want to or not, when you go into those places, you do everybody in our community a service because it exposes whoever's in the room to who we are. And we deserve to be able to go into Black owned spaces or any space and enjoy whatever it is without feeling like we have to either hide ourselves or diminish ourselves in order to participate.
Oh my God, that was so amazing. And I love that you were vulnerable because your example really shows us how bias can show up, right? And it does walk the line. Your example does walk the line of explicit and implicit. Because you were already saying like, okay, I won't go to a place where I don't feel comfortable, but it also changes like because you had these experiences, it changed how you viewed other places, right? And it's just so amazing that you said we have to be bold, right? Especially when we're talking about bias. And it's so amazing that you lean into your bias when I mean, I would say you lean out of your bias. Yeah, you lean out of your bias when most people lean into their bias. So being able to um, unearth that implicit bias is actually a skill, and it's one that you must possess when you are providing cultural competence services. Thank you for that example. That was really amazing. All right. So we talked about bias being a prejudice in favor against one thing, a person, or a group, with usually another, I mean, compare with another, usually in a way that's considered to be unfair, right? Biases may be held by a group, individual, or constitution and can have negative or positive consequences, right? So we often think of bias as something bad, but it can also be something good. I know that there are so many people that do amazing work across this country that I know. And I work as a consultant with a lot of grant review committees. And I am often saying, I have a bias, I have a conflict of interest because I really want to see these people win. But that's still a bias, right? It's not an equitable thing because we know equity is about those who need it the most get the most. Because we have talked about equality for so long in this country that those communities that are underserved and marginalized have been stretched so thin that in order to get our communities where we need to be to thrive, we need more than what's offered to others. We need more. We need reparations. So now let's talk about privilege. What is privilege, right? This is a very simple definition of privilege. A special right, advantage, or immunity granted or available only to a particular person or group of people. I would say privilege could also be access. Privilege could also be amenities, and these things are not earned, they're given. And they are done in a way that is placing other groups in unfavorable positions. So if it's granted to one person, then the person on the other end has unfavorable conditions. So when we talk about stigma, right? What can somebody define to me what stigma is? Come off the mic and define stigma. Because when this slide says anti-stigmas. So as organizations and CBOs, we want to have anti-stigma programs, anti-stigma procedures, anti-stigma strategies, right? Everything we want to do should be rooted in anti-stigma. But can someone tell me what their definition of stigma is? And I'll be calling on y'all all day, so let's get warmed up.
Jasmine, can you hear me?
Yes.
So stigma for like, so just to make sure I understand, you just want us to define stigma, correct? Not anti-stigma,
Yes.
stigma.
No,
Okay.
stigma.
Okay, so stigma, in my head, stigma is really encompassing, creating an idea or concept in a negative light, or sometimes it can be in positive lights, but creating this concept of and thinking about the biases and things of that nature, and really encompassing in one group, like saying, everybody who lives in the South has a Southern accent. Or so that can be, depending on the way you look at it, that can be stigmatizing in its own, right?
Absolutely. Absolutely. I would say you are so right. I always compare stigmas to myths. I think that stigma is a myth about something or someone that is unfavorable or bad. And when we think about anti-stigma, we're thinking about how do we create programs? How do we create policies? How do we create procedures? And all of those things create the culture. So the bigger question is, how do we create a culture that is rooted in anti-stigma practices as organizations? There are different types of stigma, and we know that, right? So we have to push against all different types of stigma. So stigma will be a mark of shame or discredit, right? What is the root cause of stigma? It could be the lack of knowledge. It could be fear-based messages. It could be morality. Let's talk about morality. That's a big one, I think, because of the South, because we live in the Bible Belt in Memphis. That's one that's really big, right? There's a lot of stigma that comes along with sex. There's a lot of stigma that comes along with being from the LGBTQIA community. There's a lot of stigma that comes along with being trans. There's a lot of stigma that comes with being HIV positive. I'm sorry, being a person who lives with HIV. There's a lot of different things around morality, right? That stigma just grabs a hold, right? And then you have the God effect or the karma effect. That is really a heavy one as well in the South when we're thinking about Christianity, and how we may even view ourselves if we grew up in Christianity. I know I am a church girl, so there's a lot of stigma that was rooted or internalized stigma that I had that came from like what I learned in church and what I thought about myself. Um, and what I thought the Bible said about me, right? Those things and created stigma. I didn't even have to. It only took me to hear one thing from one person, and then things were created and took on a life of their own. Good things happen to good people, right? We often think that nothing good can happen to us because we're not good people. We often think that we are going through things because we're bad people. And then the last one, we often think that bad people make bad decisions versus good people make bad decisions. People make decisions, good and bad, every day. That's a part of life. Now, let's talk about the type of stigma. So you have structural stigma, which is what? Institutions. And then you have intersectional stigma, which is your race, your class, your sexuality, your gender, your social. So you're working through so much stigma because a lot of people that are on this call, a lot of people that will come in for services have experiences with both, right? If you are Black and you are trans, you're dealing or you're pushing against structural stigma and you're pushing against intersectional stigma. These are things that you just can't get away from because of your identity, just starting with your identity. Being Black and being a woman and being Black and being trans is the same thing, right? But oftentimes the stigma looks different for both communities because at different intersections they switch. If you are a person who does sex work, right, it looks different. If you're a person living with HIV, it looks different because those institutions have laws that criminalize people who do sex work and people who are living with HIV. So those those types of stigma are the same, but the way they show up in the different participants' lives will look different. And we have to honor all of this when we're doing the work to support the people that we are serving. So here's some strategies to address stigma. You have the provision of information, consists of teaching participants about the condition itself or about stigma, its manifestations, and its effects on health. You have skill building activities, involve creating opportunities for healthcare providers to develop the appropriate skills to work directly with the stigmatized group. You have participatory learning, approaches require participants to actively engage in the intervention. You have contact with the stigmatized group, rely on heavily involving the members of the stigmatized group in the delivery of the interventions to develop empathy, humanize the stigmatized individual, and break down stereotypes. You have an empowerment approach, which is used to improve client coping mechanisms to overcome stigma at the health facility level. And then you have structural or policy change approaches, including changing policies, providing clinical materials, redress systems, and facility restructuring. So oftentimes we know that your organization hopefully has tried one of these. If not, take a picture of these now. These are ways to address stigma, and these are ways that our organization has used, other organizations has used, and they really work. I think one of my favorite strategies to address stigma is contact with stigmatized group. This is something that is easy for organizations to do. All you have to do is create a focus group and, curate a space that is led by the group themselves. Provide talking points, ask questions, allow them to tell you what it is that they would like for you as an organization to know. You can ask questions to improve upon services that you provide, but this is a way to do that. And you want to keep in consistent contact with them. So maybe creating an advisory board, right? Where they do a meeting a quarter. There's different ways. Another way that may be harder is structural or policy change, right? Where we're changing the policies, we're changing the clinical materials, we're restructuring the facility from the bottom all the way to the top and back again. So there's different ways to do this. And I think that if you really assess how deep the stigma is attached to the group and also attached to your policies and attached to your organizations and practices, that will kind of inform you on how many strategies you need to implement. Cultural humility. We hear a lot about cultural competency, but we really need to start with cultural humility as the approach to achieve cultural competency. Cultural competency is a set of practices, but cultural humility is an attitude and a presence. Attributes of cultural humility are openness, self-awareness, being egoless, supportive interactions, self-reflection, and critique. Okay? Outcomes of cultural humility are empowerment of the community you serve, mutual benefits for the provider and the community, partnerships between the provider and the community and other providers, optimal care, and respect. How many of us want respect? And I think that that last one should be our overarching goal, right? Is to respect the person that we're serving, right? Not respect a demographic. We're respecting a person. And these attributes of cultural humility will allow them to see the person in us, right? Us being open, us being self-aware, us not having an ego, and just being there for those supportive interactions. And that self-reflection and critique allows them to see the human in you. 3 principles of cultural humility are lifelong learning and critical self-reflection. So you won't get to an awareness about other people that you can stop learning. You won't ever get to an awareness about yourself that you can ever stop learning. So this needs to be a lifelong learning and critical self-reflection commitment. Recognizing and challenging power imbalance. So recognizing and challenging those power imbalances, even when they work in your favor. Institutional accountability. We have to, as organizations, hold each other and our organization as a whole accountable to ensure equitable and cultural competent services. The predecessors of cultural humility and diversity. Our power imbalance. So let's talk about culture. Let's back up. No, you've seen it. I'll go there. Let's look at these definitions of culture. So the first one is a social system of meaning and a custom that is developed by a group of people to assure its adaptation. And key word here is survival. These groups are distinguished by a set of unspoken values, beliefs, patterns of thinking, behaviors, and styles of communication. So when we're talking about a culture, we're talking about the way people show up and how they survive, how they live, how they think, right? These are all wrapped in their culture. Here's another one. Culture is the patterns of learned behaviors and values which are shared among members of a designated group and usually transmitted to others through a group of time. I love this definition because it's talking about how patterns and values are shared and transmitted through time. So not only are we talking about people adapting and surviving and how they believe and how they behave in the first definition, but this definition goes into how it is transferred. So that's how the culture continues and how it thrives, right? Then we have another definition, culture, the totality of socially transmitted behavioral patterns, arts, beliefs, values, customs, lifeways, and all other products of human work and thought characteristics of a population of people that guide their worldview and decision-making. Keyword being decision-making. So now after we have the values and the beliefs for adaptation and survival, we then transfer them to other people in the community, or even over the years through generations. And then we come to having socially transmitted behavior patterns, the arts, the values, and we will guide our worldview and decision making based on that. And then the most simple definition, which is actually my favorite, culture is the software of the mind. So I'm going to start with culture being the software of the mind. If we are an organization or we are a clinic or a hospital, the software that we use is always going to need an update, correct? Can I get a reaction, a hand clap or a thumbs up or heart? If your software always needs to be updated at work or even on your own computer, or even if you have an iPhone, right? If you have an iPhone, please update your iPhone because they do not work when you don't update. Now, the culture is how we do things, right? At our organization, our policies, our procedures, our practices. So those cultures should also receive an update. Do we agree with that? And if we do not update our culture as organizations, it may affect the worldview and the decision making. We will look at our participants according to our cultures and practices that are out of date, which will mean we will provide out of date services if we don't update our culture. And then we have to also, when updating our culture, we have to have new learned behaviors and values, which are shared among our members and transmitted over time, right? And then we're going to make sure that our cultural practices are there for our adaptation and our survival as organizations, because it's key that we survive and thrive to do the work that we're doing as organizations. That's why it's key that we update our culture. Cultural competency is a set of congruent behaviors, attitudes, and policies that come together in a system or agency or among professionals that enables effective interactions in cross-cultural framework. So when we have cultural competency, we're not only working to have cultural humility, right? But we want to have a set of congruent behaviors, attitudes, and policies. So cultural competency speaks to the organization as a whole. When we talk about a holistic approach and how we engage our participants and we provide wraparound services, we actually have to have wraparound behaviors, wraparound attitudes and policies, right? That go from our organization from the left to the right, to the top, to the bottom, and the bottom up to ensure that everybody has the correct behaviors. Everybody has the correct attitudes, and we have the policies in place that come together and align with their cross-cultural framework. And when we're talking about cross-cultural, we're not just talking about race, right? There are cultures within cultures. We know about, well, I don't know. Does anyone know about ballroom culture? Do you know the culture of trans women? What about the culture of Black trans women? What about the culture of same gender loving men? Right? What about lesbian culture? There are so many cultures within the cultures that we think about when we think about race, right? There's so many identities within the social construct known as race. So here are the 5 components of cultural competence. Cultural awareness involves the process of conducting a self-examination and critical reflection of one's own biases towards other cultures, and also an in-depth exploration of one's cultural background. So, your cultural awareness, you have to be able to assess who you are and where you came from, right? What were your cultures? What were your traditions? What were your beliefs? And what were they rooted in? Okay. Then you have cultural knowledge. It's defined as is the process in which a provider seeks and obtains a sound educational base about culturally diverse groups. I'm sorry, let me go back to cultural awareness. Cultural awareness works both ways. I phrased it just one way, but it works both ways. So as a provider, you need to know a self-examination and a critical self of your own biases towards other cultures and why, and an in-depth exploration of your own cultural background, right? But you also want to do an in-depth exploration of others' cultural background. Because when you're doing a self-assessment of your culture, there are many times that your privilege will show up and you need to assess what the other side of that privilege looked like, okay? And that will bring you to cultural knowledge, where you would define find and define an educational base about culturally diverse groups. Then you will practice cultural skill. That is the ability to conduct a cultural assessment to collect relevant cultural data regarding the patients or the participants that you serve. So let me tell you this. If you want to do a cultural assessment, you want to make sure that you're asking the questions in a respectful way and that you're only asking the questions you need for your data. Too many times people create cultural assessments and they almost are not respectful of communities because they ask questions that don't involve the data that they're seeking. So make sure that you're asking the right questions. And I would say, of course, you need to work with a person from the community or 2 or 3 people from the community to help you create this assessment. So, yes, enact your cultural skill by creating the assessment. Then you want to move on to your cultural encounters. Cultural encounters encourage the provider to directly engage in face-to-face interactions and other types of encounters with patients from culturally diverse backgrounds to modify existing beliefs about a cultural group and prevent possible stereotyping. So what does that mean? You basically need to meet with those people that you serve. The provider needs to engage directly. This can be a mixer. This can be, I don't know. I say mixer because I like food and drinks, but this can be any time you get the providers and the team from your organization or your clinics to engage with the participants. This can modify, or you know what? I wouldn't even say modify existing beliefs. This can cut some of the tension and remove some of the layers, right? And allow people to get to know each other, therefore modifying existing beliefs about a cultural group and prevent possible stereotyping, right? And hopefully dismantle some of that stigma because, you know, the stereotyping has probably already happened. Cultural desire is the motivation of the provider to want to, as opposed to have to. Oh, can I get a wave in the air? Can somebody give me a clap? We need for the provider to want to, not just have to, not just because it's for your money, but we need for you to want to know your participant, want to know your client, and engage in the process of becoming culturally aware, culturally knowledgeable, culturally skillful, and also seeking cultural encounters. So, what are cultural encounters? I love that term. A cultural encounter allows a participant to show up as their full self. You acknowledge them and you learn about them. That is a cultural encounter. And I think that that is some amazing that is some amazing work to do being a provider. If you can engage in a cultural encounter with your participant, you have went above and beyond at that point because you really have, dare I say, become friends, right? And I know that people don't think about being friends with your client, but what you all don't understand as providers is trans people and many people that come into the provider would love to feel like they're friends with their doctor, would love to feel like they're friends with the person at the front desk, would love to feel like they're friends with their case manager, right? These and I don't want you all to take the word friends and think, oh, you're gonna hang with them outside of work, but this is what creates a space where trans people can thrive. This is what creates a space where people living with HIV can thrive when they feel like they can trust their provider, when they feel seen by their provider. That's where the friendship comes in. And oftentimes in life, trans people don't have the opportunity to feel seen. So, you know, someone that sees them, even if it is their provider, even if it is the security guard at the clinic, they feel like a pal. They feel like a friend. And it provides a much better experience for them. So organizational culture is what we're talking about, and it's so important because all of these things wrapped into one will create your organizational culture. Um, and I think that I'll ask questions, I'll let you all ask questions at the end, but I'll ask you all to bring this up later. How many times have you worked somewhere where the organizational culture was one that you didn't align with? My question to you is, what did you do about it? How can you change it? Because you will be implementing and changing the cultures of organizations, or you will be instrumental in them staying the same and them not being accessible. So I hope today that you can really engage and absorb some of what we're talking about, because you are the change. Where you work is not the problem. If you're there and it's continuing, you be a part of the change, or you will be a part of the problem. So your best practices are cultural humility, right? Lifelong commitment, self-reflection, creating cultural encounters, right? Removing biases. You have to remove your bias. Just for the moment, we're not asking you to remove it forever, but remove it for the moment so you can provide the best service. Then acknowledge your privilege. How can you honor and provide equitable services? Remember, we're talking about equity. How can those who need it the most get it the most if you don't honor that you've been getting it the most? You have to get out the way, acknowledge your privilege. And then you have to embrace intersectionality. So many times we have talked and said the word intersectionality. Intersectionality is a term coined by a Black woman, Kimberly Williams Crenshaw. If y'all can look her up and just look at what she says about intersectionality, it's so amazing. And truly understanding intersectionality allows you to be able to provide those services in a way that meets people where they are truly, not meets them on the street and asks them to walk down, but meets them where they are. And then we talk about meaningful involvement, right? We have to meaningfully involve every community that we serve at every level of the programming, every level. And I know that's hard to hear for people in clinical settings, people at larger organizations, but it's not hard. Hire consultants, hire, I'm sorry, create focus groups, allow that consultant to facilitate that group so that it feels familiar to the participants. But yes, meaningfully involve those communities that you serve in every part of your process. And then lead with the harm reduction lens. Have harm reduction principles. Do not try and create plans, practices, and journeys for other people. Create spaces that allow them the safety to create their own plans, their own journeys, because they have that autonomy. It is their birthright. You create a space that supports that, that reminds them of that, that helps them to lean into their own leadership so that they can have healthy outcomes, right? And make the best decisions they deem best for themselves. Cultural humility incorporates a lifelong commitment to self-evaluation and critique, addressing the power imbalances to the physician-patient dynamic, and developing mutually beneficial and non-paternalistic partnership with communities on behalf of individuals' defined populations. Okay, thank you so much. I want to open it up for questions, but I'm going to leave this screen up so y'all can have my email and our website. But yeah, let's open it up to questions. I'm going to turn my camera back on now. Let's hear about some experiences. Let's talk about some questions. I love to hear about. And I know that y'all think that you can't say, but like this is a space to talk about ways that we can push against stigma. So if you have any examples or anything that we can talk through, now is the time. And I would just love to hear from y'all.
Well, I'll say something, even though I said something earlier. Let me first say thank you, Jasmine. That presentation was really helpful, and like insightful. My question would be, how do you think someone should approach, I would say, in an ideal, like culture at work? Because I know sometimes head on would be like how a lot of people would want to, but sometimes that's not effective. It'll cause people to be defensive, and it could create tension where you're really just trying to make it comfortable and open for everybody to be able to work and be honest about experiences and input. um, so I'm just kind of wondering, like, what would be like the first step in like kind of wanting to open that up to make it to where everybody feels comfortable sharing different things, um, in the workplace.
So I would say my first piece of advice is secure your job. Make sure that you think about the culture and assess the culture of how things will go after you start to air your grievances and start to talk to others about their experiences. After you do that, I would say starts the real work. So I would create a survey, which will be anonymous, that people on the team or the staff could share their experiences. I would then create a report, right? But within their report, I probably would do a PowerPoint and ask the team to meet, and share the findings of the data report and have some solution-based strategies within the PowerPoint. Um, and that would just be, I'm sorry, let me say this. Of course, before you call a meeting, as we know, I'm the executive director, so I'm used to just calling meetings. But yeah, you would have to probably speak with your supervisor. But I think that it would be good if you could say, "Hey, we have this needs assessment that we've done. It's been anonymous. We can talk about the findings. We can bring up people's experiences and talk about strategies to move forward." I think that that would be assuming that you have a culture of people that will listen. um, and then I would say if you don't have people that listen, you have to maybe go above the person that you directly report to. And maybe even if they have an HR department, do the same thing with HR, but you would have to make sure that you're covering yourself within your job. But I don't think that collecting people's experiences, especially if they're anonymous, would hurt. But I think that we have to be bold when we're working in positions because it's not only your experience, right? Where you may have a bad experience, but someone else has had that same experience and may not be able to advocate for that. And you know, being a person from our community, we have to push to be seen. Just like you said earlier, we're exposing the world to who we are in this community every time we're seen. So wherever we are called to work at, we must require they respect us and we must require that the culture, is conducive for us to thrive, not just for us to work.
Thank you.
Thank you.
No questions, but just to express gratitude, Jasmine. And I always love hearing people mention. I believe I believe you say it first. Is it Kimberly or Kimberly Crenshaw? I love her TED videos. I've watched like all of them on intersectionality, and it's amazing.
Yes, yes, they are the best. And she breaks it down in a way that we really can censor the need because intersectionality was created as a framework to explain how this woman was marginalized, at work. And there was no name for it prior to that. People, didn't understand how things impact you and it becomes worse. Before it was either I'm either discriminated against because I'm black or I'm discriminated against because I'm a woman. It was never thought to be discriminated against as a black woman would be even worse than being discriminated against as just a black man so there's levels to discrimination and it's all rooted in intersectionality and it's really important that we understand that because that helps us to as providers and as people who provide service we have to know where our participants or our clients are at when they come through the door. We have to be understanding of them. They don't have to be understanding of us. But for us to be proper, truly understanding of them, we have to understand ourselves and understand how our privilege shows up. So intersectionality is a great place to start learning how to practice your cultural humility.
Any other questions that we have for Jasmine? Well, if not, then the only additional question I have for you, Jasmine, is would you like to, when we send out the recording, would you like to share your PowerPoint with the audience?
I normally don't share the PowerPoint, but
Yeah.
they'll see the recording. So
Right, that is perfectly okay. And with that being said, I appreciate everybody who has been on the call. Any last thoughts that you would like to share, Jasmine, before we close it out?
no, I just want to thank everybody for today and encourage you all that if you do practice what we talked about today, you will find many areas that you can not only do self work, but you can do work at your organization to push against stigma and to really provide the services that are necessary, not the services that people just want to provide. There are required services and necessary services that community needs, and we need for people to provide them in a culturally competent way. So I thank you all for being here today. Please share some of what you learned with others and put it into practice. Thank you.
Thank you, Jasmine. I hope you see my hand claps. We are
Yes,
so
I
appreciative.
guess.
With that being said, Sherry, you can definitely stop the. Wait, hold on a second. We have Robin. Did you mean to raise your hand?
No, I was trying to give a hand clap.
Thank you, Robin.
That happens to me too. But thank you so much, Jasmine. Sherry, you can go ahead and stop the recording and we will share the